My name is Ali Khoynezhad. I'm a cardiovascular surgeon and director of cardiovascular surgery at MemorialCare, Long Beach Medical Center. My specialty within cardiovascular surgery is heart valve disease, atrial fibrillation, and aortic operations. I trained with Dr. Robert Frater, and when I was in Europe, I had access to Dr. Alain Carpentier, who's a pioneer in mitral valve repair. I also trained and worked with Dr. Cox as well as Dr. Damiano. The reason why I'm in this field is because we have powerful and very efficient tools to treat both pathologies. The heart valve disease and atrial fibrillation are closely connected to each other. Heart valve disease is number 3 cause of atrial fibrillation worldwide. If you look at number 1 and 2, that's actually coronary artery disease and hypertension. The symptoms of atrial fibrillation could be shortness of breath, it could be palpitation, a lack of energy. Some patients, however, have completely no symptoms from atrial fibrillation. The issues with atrial fibrillation is it can cause embolic events. When you have a quivering of upper chamber of the heart, you can have stagnation of blood in the portions of the left atrium, which is called left atrial appendage. That clot can break up and can go to anywhere, including the brain, causing stroke, or any other organs within the body. The other issue with atrial fibrillation is heart failure and cardiomyopathy. With a rapid heart rate, the heart doesn't have an efficient heartbeat. The other issue with atrial fibrillation is that the longevity of the patients typically shorten. If you look at patients with similar age, similar medical problems, one with atrial fibrillation and one without, the ones with atrial fibrillation typically live about 15% less than the ones that does not have atrial fibrillation. One other risk of the atrial fibrillation that we are aware is actually Alzheimer's. So patients with atrial fibrillation have significantly higher risk of developing Alzheimer's compared to people who do not. So treatment of heart valve disease entails either valve repair or valve replacement. This includes, for example, a ring annuloplasty. This includes, for example, a patch. This includes augmentation of the leaflets and bringing the leaflets the same height. For replacement, we have mechanical and bioprostheses that have been in the market for quite some time. So treatment of atrial fibrillation includes typically a maze operation. The maze is placing a scar lines in the upper chamber of the heart. Now, many people feel a scar is bad for the heart, but actually for atrial fibrillation patients, a scar in the upper chamber is good, and it can reduce the incidence of atrial fibrillation. And the procedure is very successful. We're looking at about a 95% success with the maze in patients who have long-term atrial fibrillation, which is amazing. So it's critical that patients who have valvular heart disease and atrial fibrillation are treated together at the same time. There's a tendency among the cardiothoracic surgeons to neglect the atrial fibrillation and just concentrate on valvular heart disease. And it's very important for us to educate the cardiovascular community to make sure the atrial fibrillation has to be treated in the same time the valve is treated. And hopefully patient will demand that as well. If the patient has been told that he or she requires a valve operation and an atrial fibrillation surgery, it's important first to know why this is the reason. What's the indication for atrial fibrillation and valve repair or replacement? The second thing is I highly recommend for the patients to do their homework and evaluate surgeons who are well experienced and also do on a regular basis both atrial fibrillation and valvular heart disease.